Hi guys, Jared here with Smart Group Training. Most of you guys know me by now, and today I've got Dr. Evan Osar on the line with me. So I'm going to let Evan give a quick introduction, why you should listen to him, why he's relevant, and then our topic today we're going to discuss some female training. So recently we bought a gym that's an all-women gym. So it's definitely relevant to what we're doing. And I know it's going to be relevant to our viewers as a good chunk of trainers kind of focus around females. So Evan, can you give us a quick introduction so my viewers, if they don't know you, they can get a little info on you?
Absolutely. Thanks for having me. I really appreciate it. You and I have known each other for quite a few years. We met at Mike Roberts' training symposium down there in Indianapolis quite a few years ago. So it's been great getting to know you over the years. I'm a chiropractic physician by trade. I work with my wife, who's a manual therapist and also a movement specialist, and also Sarah Fisher, our integrative movement specialist, who does a lot of our training. And she functions almost like a physical therapist because she can work underneath my license, and she carries out the strategies that we'll share with you and your viewers in this webinar here. So I'm super excited to present this information. This is really a synopsis of the integrated movement system, our approach to how we look at our clients and train our female clients. And really, it's a program put together by my wife and Sarah Fisher, and I'll introduce them as well as we go along, and just share some real quick, easy tidbits that you can plug right into the programs that your viewers are already using with success. So it's not going to be about reinventing the wheel. However, there's a lot of confusion around this topic of training the female core and some things you want to pay attention to. So I'll highlight some of those things that tend to be a little confusing. There's a lot of misconceptions around, and then also give you a strategy to, like I said, plug right into the programs that your viewers are already using with success. So let me switch over my computer so you can see my screen.
Perfect.
Let me see. Should be here. Can you see that?
Yep, sure can.
Perfect. Awesome. If anything comes up, like you can't see my screen or anything, please rise. Sometimes you know how these things work here. But so essentially we're going to be reframing training, how we train the female core. So this is going to be the approach we use with our clients in our office and that we teach during our workshops and events. And I'll share a great program we put together for your viewers at the end of this presentation if they're looking for more information on this topic. So the one thing I always ask when I start to teach this course is, what's the best core exercises or core exercise? So you think about all the exercises that you do with your client, like what's the best exercise you would use with your female clients? So we'll answer that question as we go along today, but I just want to get your viewers thinking about that topic as we go along, because there's a lot of debate, like, should I do plank? Should I do burpees? Should I do crunches? Should I do some Pilates? So we'll talk a lot about that. So just think of that as we go through this presentation.
Cool.
So our goals of this webinar is, number one, to understand the difference between strength and strategy, and that'll make sense as we go through this presentation. And the problems with the Get Fit approach, and I'll just explain what the Get Fit acronym stands for, and then the ABCs are your key to improving how your female clients use their core and how they function. So as I mentioned, Sarah Fisher to the left of your screen and my wife, Janice Maddock, work with us. This is our team of integrated movement specialists here in Chicago, and they really helped create this program, and they are specializing in working with the female clients, especially after female clients have had C-sections, hysterectomies, any kind of abdominal, breast, and back surgeries. Sarah Fisher started out as a professional dancer. She had a C-section with her first son, and her health and her ability to dance sort of spiraled downward from there. And so it really put her on this journey to figure out what she was doing or what she could do for her own core, because she started developing a lot of issues, and which essentially took her out of dance. So this is a lot of the information that she started to put together for herself to help herself feel better, and then that they also use with their female clients that come and see them in our clinic. So our current industry's paradigm is, what exercises should I do to help strengthen my client's core? And we hear that all the time, that if you have back pain, strengthen the core. If you got hip issues, you got to strengthen your core. Hey, you got shoulder and neck issues, you better strengthen your core. But I want you to think about the incidence of low back pain or neck pain or surgery, or the amount of people taking opioids and different types of medication for back and hip type issues. And think about it. with all this core training we've been doing over the years, has it really decreased the incidence of low back pain or hip issues or different types of surgeries? And the answer is no. It hasn't changed the incidence. In fact, if anything, the rate of low back pain with people that exercise is actually going up. Some people do feel better, obviously, and exercise is a big part of dealing with chronic issues, tightness, discomfort, and or inability to perform at the levels one needs and or wants. But a lot of our clients that are exercising, have strong core, still are experiencing chronic issues. So we're going to change the paradigm. Because what I want you to think about are the clients, some of your strongest clients. So some of our patients that we see now, we're getting tons of CrossFit, women that are doing CrossFit, tons of women that are doing boot camp and core type classes, women that can hold 7-minute planks or longer, and they still have chronic low back pain. So the one thing I always ask my client when they come in and say, well, I can do a 7-minute plank. I'm like, so what will happen when you do a 12-minute plank? Will your low back pain go away? So it's not really about strength. It's really not even about so much endurance. So what's it about? And we'll discuss that as we go along. So it's not about your exercises, because all of us, all of your listeners and viewers, we all have tons of exercises for the core. We don't need more exercises for the core. So what do we actually need? We need a paradigm shift. And the question I want you to start to think and ask yourself is, how do I help my clients develop a more optimal and efficient core stabilization strategy? And as I started to teach this concept, I needed to illustrate this point, because people think when they look at athletes, hey, this athlete's real strong. She's got a strong core. That's why she performs so well. So I started thinking about it, and I'm like, is that really why she performs well? Because if you take two equal athletes and one has a stronger core than the other, then yeah, they're probably the stronger female athlete will perform better. But is that really what differentiates the most elite athletes? Is their strength? And I would argue that it's actually not their strength. It's actually their strategy. So what is an optimal, or how can we illustrate what an optimal and efficient strategy is all about? So I came across this picture, and it really hit me, like, this is what it's all about. When you think about carrying massive loads, and you're going to carry massive loads for, just say, a few miles day after day, this is the most efficient way to carry a heavy load for a long period of time. So if you look at these women from India, the Middle East, Africa, they carry massive loads of, whether it be food, whether it be dung, or whether it be water. They're carrying massive loads on top of their head because that is the most efficient way to carry. Now look at the size of these women. If you look at these women over here to the left of the screen, scrawny little arms, scrawny little core, scrawny little legs. Women over to the right, same thing. You see these women from Africa over here, barrel of water on their head and a baby on their back. So again, when we start to think about function, I mean, that's as functional as you can be, as efficient as someone can be. So what is it that allows these individuals, these women, to do this? It's all about their strategy. It's not about their strength, because most viewers, health and fitness professionals, they can out squat, out deadlift, out kettlebell swing, out plank these women, but they can't take this task on, put a heavy, massive load on top of your head, or don't want to take this task on, put a heavy load on top of your head and walk from mile upon mile without it crushing your neck, crushing your back, and very easily fatiguing the person out. So we'll talk about what is it that these women do that allow them to have this optimal and efficient strategy, and what can we learn from these women and use as part of our workout programs, our training programs, our rehab programs to help our female clients perform at their greatest level. So most important thing I want you to take home from this webinar is focus on strategy before strength. Yes, strength is important, but you want to put strength on top of an optimal and efficient strategy. You want to build endurance on top of an optimal and efficient strategy, as well as power, as well as things like flexibility. Develop the strategy first, and then you train all the things that you're awesome at training. However, don't overlook developing a more optimal and efficient strategy in lieu of strength, endurance, power, and or flexibility, because that's what ultimately will start to break your client down. So this will lead into the next part of the conversation, where we talk about the get fit concept. Just before we get to the get fit concept and approach, we just want to talk about what the core is to us. The core is what we refer to as the thoracopelvic cylinder. It's the thorax sitting on top of the pelvis. It's also including the rib cage and thoracic spine, the lumbar spine, not pictured here, but it would be sitting here between the thorax and the pelvis itself, because it forms a virtual cylinder. And the more optimal the cylinder is aligned and controlled, the more optimal and efficient the core can function. Because essentially, the thoracolpelvic cylinder is a series of stacked rings. So you have the pelvic ring, and then you have the lumbar area of the spine, where you have the transversus abdominis that forms this sort of myofascial tension that blends into the thoracolumbar fascia in the back. So it becomes this myofascial osseous ring in the lumbar area of the spine. And then you have these thoracic rings that sit on top, a series of stacked rings that sit on top. So basically, the goal with your core training is to align and stack the rings. So you want the pelvis to be underneath the lumbosacral ring, I should say the lumbar ring, myofascial ring, and then the thoracic ring stacked on top of that. And the more optimal and efficient that stacking becomes, the more optimal and efficient breathing becomes, the more optimal and efficient your core stabilization strategy becomes. And we'll talk about some strategies of how to create that in your clients as we go along. So during our training, we want to respect alignment and control of the thoracolpelvic cylinder through our exercise progressions. We'll talk about in the beginning how we set up our clients, and it's really all about training neutral, I should back up for a second, training neutral alignment of the thoracolpelvic cylinder, teaching the client how to align and control and maintain this alignment as they go through patterns like bird dog, dissociating the arm and or hip from the thoracolpelvic cylinder, or a pike position where you're, again, dissociating the hip from the TPC. But again, it's really developing that awareness and control of that thoracolpelvic cylinder prior to teaching your client how to flex, side bend, rotate, and do all those dynamic type of movements. So it's really teaching those anti-flexion, anti-extension, anti-rotation type of movements for your client. And once they've developed the competence in those patterns, then start to introduce flexion and or rotation. So this is the challenge we have with our clients. We all have this challenge. Your client comes to you and they say, but I need to get fit. My trainer, my doctor, my therapist told me I just need to strengthen my core. And we hear that all the time. So it sort of leads us to get stuck a little bit, or it leads to a conundrum, because as I mentioned, it's really not about strength. And this is a big conversation and education we have to do with our clients in our office, is that we're going to help you get stronger. However, we're going to first change your strategy, because if you're just trying to get fit, here's the challenges that clients will run into. And this is actually why a lot of core training will perpetuate chronic tightness, discomfort, as well as loss of optimal and efficient performance. And this is the acronym GET FIT. First is gripping. Too many of our clients have been taught to over-grip their abdominal wall and their glutes and hamstrings. And what happens is it drives them into posterior pelvic tilt and lumbar spine flexion, as it's done in my client here. And she's a big abdominal gripper here. She's a little bit of a glute gripper as well. She's gotten into posterior pelvic tilt, which flattens the lumbar lordosis and actually puts her at an increased risk for low back problems. Clients also present with back gripping. This is another patient with chronic low back and neck tension. So she's more of a back gripper. So she's hyperextended through her thorax and at the thoracolumbar junction. You can see how her thorax has moved behind her pelvis. So she's not doing a great job aligning and controlling her thoracolpelvic cylinder. And she also developed neck problems, because the more your thorax moves back behind your pelvis, the more your head and neck start to straighten it out and will go the opposite direction. So that's another common cause of chronic neck and shoulder type issues. E of the GET FIT acronym is energy. It takes a lot of energy. I'm going to back up just for a second. It takes a lot of energy to be gripping and stay in this gripping type of strategy. So that's why clients feel so fatigued by the end of the day, is because they're gripping so much during the day, they're not letting it go. So it requires a lot of energy. If we think about those ladies carrying those massive loads on top of their head, they're not braced up. I'm going to back up. I just want to show that picture again. And what you're going to see is that these women are actually not really braced up at all. They probably had a brace to get that load on top of their head, or I should say they did brace to get the load on top of their head. But if you look, this woman's hips are actually swaying side to side. She's not gripped up. She's not braced up. So once we set our clients up for success with alignment, breathing, and control, then we can let them move more freely, and it's not about over gripping or over bracing, which is happening to too many of our clients and being perpetuated and taught by a lot of approaches in our industry. So let me just forward back where we were. So gripping, and then there's a big energy expenditure that comes with an over gripping or over bracing type of strategy. That leads to tightness. When clients are over gripping, especially for stability, they'll get tight. And that's where a lot of our clients' chronic tightness comes. And then we have lots of clients, and I'm sure you do too, and your viewers do as well, that say to you, I myofascial release. I go to my chiropractor, I stretch, and I go to yoga, and I still feel tight all the time. And that's just a sign that your body is over bracing, over contracted, over gripping, and not letting go. And that's, again, that just feeds back into that over using of an energy system that your body shouldn't be doing, because the individual's not using an optimal and efficient strategy. That leads to fatigue. That's why so many of our clients feel fatigued by the end of the day, because they're using too much effort for simple tasks, for sitting, for walking, for standing. They're braced up, they're gripped up, they feel tight all day long, and over time, it just leads to fatigue, because the strategy they're using is non-optimal and inefficient. So the more efficient we can help our clients become, the less effort they have to use, the less tightness they'll experience, the less gripping they'll need to do, and the less fatigue they'll have. It also leads to issues with incontinence. The more our clients are bracing their core and pulling their abs in, the more the pressure starts to go down towards the pelvic floor. That also causes gripping of the pelvic floor. And a lot of people will say, well, incontinence is just kind of a normal thing. Common is not normal. Common is not what's supposed to happen. Yes, a lot of women have incontinence. In fact, 1 in 3 women have incontinence. And they did a study on female collegiate basketball players, and 1 in 3 female collegiate basketball players had incontinence. They did a study on dancers and runners. They showed the highest incidence. They're actually a little bit higher than 1 in 3. They're closer to almost 40% of runners and high distance runners, long distance runners, and competitive gymnasts have incontinence. So the more incontinence a woman has, the more she's going to start to grip her pelvic floor and adductors. So that will lead to low back tightness, as well as hip and groin type tightness as well. So just perpetuating a lot of these stereotypes and patterns that our clients are getting into. The more optimal we can help our clients align, breathe, and control, the more optimal we can start to make the pelvic floor function, and in turn address some of these issues surrounding incontinence. And then the tush, because a lot of women want to get a better shaped glutes. And what happens is, or should say, the glutes should be round, sort of full muscles, as this model is illustrating here. But what happens is, this is a big thumbs up of how you want your glutes to function. You want to have a slight anterior pelvic tilt, because that's what essentially helps the pelvis be in the right position. It maintains the lumbar lordosis, and it helps load optimally squats, lunges, and a lot of the core type patterns that we want our clients to do. What happens, though, is with gripping, the client will start to over grip those external hip rotators and the glutes, and then they start to flatten out the glutes by going into that posterior pelvic tilted position, as my client here is demonstrating. And they start to have this dimple sort of appearance of their glutes, and their glutes don't look round anymore. They look sort of flat and hollow. And we see that in our older clients who've been gripping for many years, for a long period of time. Their glutes look very flat and almost atrophied because they're over gripping. To get the glutes to come back to their normal shape and function, more importantly, their function, we want to help our clients actually teach them how to actually release and let go and stop gripping so much from their glutes, especially during some of their hip patterns, and we'll demonstrate an example of that later on. So we don't want that posterior pelvic tilt. We don't want over gripping of the tushy and or glutes. So that's when your client really comes to you with these strategies, when they have the gripping, when they have too much energy expenditure, when they have that chronic tightness, when they have incontinence. They may not come to you for incontinence, but they may have incontinence as part of their medical history. They may have that flat tushy, the hips that are too far forward in the hip sockets. So they need help. They may say to you, hey, I want to get fit. I want to lose weight. I want to feel more flexible. Basically what they're saying is, I need a more optimal and efficient core stabilization strategy. And that's essentially where my wife and I came up with the integrative movement system approach to posture and movement, and the principles for developing an optimal and efficient strategy. So as we looked at those Middle Eastern and African women, how did they develop that optimal and efficient strategy? We all developed that same strategy at one point in our lives. And that was when we started to go through development. Child development is 100% about developing the optimal and efficient strategy, like my little niece is demonstrating here, as your newborn daughter will demonstrate here in a few months when she's born. Jared, I know you're excited to observe that and watch her go through her phases. Everything a child inherently does, they're setting themselves up for optimal stability. And the principles that they use are alignment, breathing, and control. And that's what they're developing with all the movement patterns and developmental patterns and sequences that they will go through the course of their development. So what are the principles for developing an optimal and efficient strategy? We refer to them as the ABCs. First thing that the baby is doing is aligning that thoracolpelvic cylinder. And everything they're doing, whether they're on their back, their side, and or on their stomach, they're basically just functioning to create that alignment of that rib cage, that lumbar spine, and the pelvis. And you see my niece is demonstrating a perfect alignment of that thoracolpelvic cylinder as well as her head and neck. And this is the same alignment she'll take as she gets into the upright position. This is one of my patients, my wife's patients, Emily. She's a professional dancer, and you can see that she can perform that exact pattern. Even for our clients that cannot perform the same exact pattern in a happy baby position, we can use modifications of this position to help start that aligning process to get that thoracolpelvic cylinder in a more optimal position for loading. So we always begin with that neutral thoracolpelvic cylinder alignment, because my little niece here is not flattening her back down to the floor or the crib or the couch. She's just maintaining that nice natural alignment and curvatures of her spine as she starts to develop those curvatures of her spine. So we don't want to teach our clients to pull their belly button in or hollow or flatten their back down. It's like maintain that alignment of that thorax and that pelvis, whichever position you're in. Don't create this artificial type of stabilization that so many programs tend to teach. Now, breathing. I know you're a big proponent of breathing. You do a lot of breath training. I've seen a lot of your videos and your newsletters about breathing, and the industry is sort of moving that direction, which is a great thing. Unfortunately, not too many people really understand why breathing is so important and how it actually creates or why it creates a more optimal and efficient strategy. And basically, it does three things. It's all about pressure regulation. The diaphragm is really a pressure regulator. It's regulating pressure between the thoracic cavity and the abdominal and pelvic cavities. So as it's moving down, it's regulating the pressures in between the cavities, and it's regulating that internal pressure. Sometimes it's referred to as intra-abdominal pressure, but it's also the pressure within the thorax as well. So we just call it internal pressure regulation, because it's also pressure regulation in the cranium as well as the pelvic floor, and actually down to the lower extremities as well. So it's not just in the abdominal area, it's actually through all our internal vaults, so to speak, the cranial vault, the thoracic vault, as well as the lumbopelvic and abdominal vault or cavities. It also provides stability. By regulating the internal pressure, it provides stability. You can think of this as blowing up the stability ball inside the thoracolpelvic cylinder. And that's why the alignment is so important, because when you have that proper alignment and you blow up the stability ball and you regulate that internal pressure, now you're sort of resistant to compressive forces. And now think about those women that carry those massive loads on top of their head. As massive load is pushing down on their head, they're able to resist that, not by muscle effort, by the proper alignment and the proper pressure regulation. It's like having that stability ball that doesn't deform because it's blown up to its appropriate level of, or volume, I should say. The thoracolpelvic cylinder is exactly the same thing. When we breathe in three-dimensional, using the entire three-dimensional capacity of the thoracolpelvic cylinder, and that means from the first rib all the way down to the pelvic floor, side to side, as well as front to back, we get the ability to regulate pressure and withstand pressure from gravity, external loads. So if we're doing a deadlift, a barbell squat, kettlebell swing, we're able to resist those compressive forces, the contraction of our muscles, and that's what really keeps what we refer to as suspension, or that nice alignment, and not that over-compressed feeling that so many of our clients have. And that's why they ultimately feel so tight, because they're being over-compressed by all these things: gravity, external loads, muscle contractions, and they just feel tightness and feel like, I just need somebody to put me on a rack and pull me out. That's what so many of my patients will ask me. And it's like, it's really just about getting your alignment and getting that three-dimensional breathing so you regulate that internal pressure and create more optimal stability. And it's also about mobility. So when our clients are telling us, hey, I feel tight all the time, I feel like I need to stretch or go to yoga, nothing wrong with going to yoga, because what does yoga do very well? They teach you how to align, they teach you how to breathe, and they teach you how to control very well. We can do the exact same things in our workout programs. So the C of ABC is control. It's about using your nervous system's regulation of your myofascial system to use the right strategy at the right time. So when you need a brace, you can brace. So in a plank position, my niece is relatively braced up. She's not rock solid, but she's relatively braced up. When she's standing up, she doesn't need as much of a brace, because She's vertically aligned, so she doesn't need to brace. My client here shouldn't need to brace to stand on single leg stance. You may need a brace in a modified plank position. You obviously need a brace when you're doing deadlift, kettlebell swings, a squat. But once you're done lifting, during the bulk of your day, your muscles should actually be very relaxed. You shouldn't need a lot of muscular effort to maintain posture and or movement patterns unless you need it specifically for a task. That's what control is all about, using the right amount of effort at the right time. Too many of our clients have chronic tightness and or discomfort and or just feel tight and inefficient in their strategy. It's really about they're using too much effort for simple movement patterns and simple movement tasks. So brace when you need it, and when you don't, let it go. So the integrative movement system approach to core training, I just want to show you a couple of examples of how we program this into, or how we sort of sequence this with some of our exercises and why we do certain exercises and maybe not other exercises. So we want to use your assessment to drive your corrective exercise strategy. And this is why I resonate a lot with what you do with smart group training, Jared, is you have an assessment process and that drives the corrective exercises you do. Too many people are just jumping on some bandwagon. I learned this exercise and I'm going to do it with all my clients, but they don't have the assessment process to dictate or drive why they're doing the exercise in the first place. So use your assessments to drive why you're doing your corrective and what you're doing with your corrective exercise strategy, because your assessments are really telling you where your client's non-optimal and inefficient posture and movement habits. Your corrective exercises are just addressing those non-optimal and inefficient posture and movement habits. Use the ABCs. Every exercise we're doing, we're trying to help our client better align, better breathe, better control, and to maintain those ABCs through their exercise patterns. And the other important key point is to use the most appropriate progressions. Too many of our clients are getting into these patterns, or they're going to these boot camp classes and they're doing patterns that are way too high level for their level of control at this time. There's nothing wrong with regressing a pattern and allowing a client to develop confidence in. And that's really how we help so many of our clients, whatever level they come into us, whether they're CrossFit, whether they're a professional athlete, whether they're just a mom or a desk worker that they're just looking to deal with chronic tightness and or discomfort. It's using the level of progression. And most of the times we have to regress our clients. And even though they may feel like, oh, it's a step back, it's not a step back. It's a regression so that you can progress, so that you can develop a more optimal and efficient strategy, so that you can progress the way you want to. And your exercise program will actually help you develop then the strength, stability, flexibility that you ultimately want it to create for you. So here's an example of what we will generally do. And this is how we take our clients through the integrated movement system corrective exercise strategy. We're going to release, we're going to activate, we're going to educate. And I know you're a big proponent of education as well. And that has to be a part of your program if you're dealing with clients that have core weakness or chronic tightness and or discomfort. Commonly, you're going to need to release the erectors. Frequently, you need to release the thoracolumbar erectors because that's where the client is over gripping and going into that hyperextended position. You need to release around the glutes and hamstrings because too many of our clients are stuck in that posterior pelvic tilt. They're over gripping their deep hip rotators. And oftentimes with women that have incontinence type of issues, they're going to need the adductors release as well because they've been using the adductors so much because they help to support the pelvic floor. So a lot of women will be over gripped from their adductors as well. You're going to activate the diaphragm, psoas, transversus abdominis, and pelvic floor, all the muscles that are part of a deep myofascial system. The most effective way to do that is through three-dimensional breathing. The diaphragm myofascially connects into the psoas myofascially connects down into the pelvic floor. Transversus abdominis wraps around to attach myofascially into the backside of the diaphragm as well. And the pelvic floor, as I mentioned, is also attached to that psoas. So it becomes this internal suspension system that helps to stabilize so the client doesn't have to overuse the superficial muscles for all those simple tasks of everyday life. So three-dimensional breathing is the number one strategy to start to activate these muscles, to upregulate these muscles and downregulate some of the superficial muscles that tend to be the client tends to be over gripping from. So we use a lot of cues, and the cues we use are to suspend, to feel as if you're being pulled up from internally towards the ceiling, or a string from the backside of the head and neck towards the ceiling. We don't have our clients lift the chest up. It's always going along, creating length through the backside of the head and neck, because that way, when you bring the head and neck up towards the ceiling, then the thorax follows where the head and neck go. when we have our clients brace to do a plank position, for example, or a stiff-legged deadlift, or a kettlebell swing, we're going to have them brace during the exercise pattern, but once they're done, let it go. So it's very important to also cue your clients to let it go. Do not live your life or walk around braced up all day long. Even though a lot of our clients will say, well, my belly seems like it's going to stick out or it's going to be flat. And it's like your stomach will be fine. Brace up when you need it. Let it go when you don't need it, which is most of everyday life. The more optimal and efficient your strategy becomes, you'll start to use your muscles appropriately, and then you won't have to start to pull them in to create that sort of flat abdominal appearance. This is essentially an example of the exercises we do and or avoid with our clients and how we cue them up during their exercise patterns. So a lot of our clients want to do planks, and we actually like planks. There's nothing wrong with a plank position, but this is ultimately what a lot of our clients look like, sort of sagging belly, they sort of collapse. My client Julia, she's lengthening through her thorax, and then she'll set herself up into the bench plank type of position. And this is very similar to the position we want our clients in. We want the head and neck and the thoracolpelvic cylinder in alignment. And from here, we're going to do three-dimensional breathing. So we'll have our client come up into that position, hold it, breathe 3 to 5 times, and then come back down. They can rest and or just come right back up. Exercises we tend to avoid are things like hyperextensions, because again, it just overdevelops the thoracic erectors and it creates too much compression on the low back. Much more effective is a stiff-legged deadlift. So we love stiff-legged deadlifts and those types of patterns with dumbbells, medicine balls, kettlebells, cables. So that way we're training hip hinging and we're also training the erectors to maintain that isometric position. A lot of our clients love this twisting type of exercises, but again, it creates excessive lumbar spine flexion and too much rotation at the lumbar area, which will really tear up your lumbar spine discs. So again, we're going to respect alignment, breathing, and control. We're going to set our clients up, maintaining alignment of their head, neck, and thoracolpelvic cylinder. Leaning back, she's still maintaining that thoracolumbar alignment. And if you notice, her lumbar spine and pelvis really don't move. The rotation comes from her upper thorax. The ball stays right in front of her chest as she rotates. And it was interesting, Julia was like, why didn't you ever give me this exercise before? Because it's crazy hard. It's crazy hard to do that exercise without creating lumbar spine flexion and staying in that neutral alignment. So again, this is the concept of an integrated movement system and how we train the female core. And it's really about using the exercises that you already have in your library and just helping your client create a more optimal and efficient strategy. So what's the best core exercise for your client? I asked you that question in the beginning of the webinar. And simply, it's the exercise that best helps your client align, breathe, and control to help create that more optimal and efficient strategy. And then you develop the endurance, strength, stability, flexibility, all the things that you want to develop on top of that more optimal and efficient strategy. And that's really how you help solve so many of your clients' low back issues, their hip issues, and just help them feel better in their bodies and become more efficient. And that's really what our job, our responsibility is as health and fitness professionals. So summary, stop gripping. The bottom line, we've helped so many of our clients deal with chronic discomfort, tightness, those inefficient strategies just by having them stop gripping. Stop gripping your glutes, stop gripping the abdominal wall, let it go, just relax, learn how to breathe three-dimensionally. Use the ABCs, align, breathe, and control, and really reinforce that through your exercise patterns, and then use the proper progressions. Don't be afraid to back your client off. Teach your client how to better align, breathe, and control. And just like my client Julia said as she was filming that video, she's like, oh, wow, that's a crazy hard exercise, and it looks so simple. Because when you help your client better align, better breathe, better control, you give them a better strategy so they feel better, they move better, and they can perform at their greatest level. So if your clients, I should say, if you're interested in learning more about our approach, we created a complete conditioning for the Female Core 2.0. It has all the strategies we use with our own clients and patients in our office. So there's over 3 hours of content. We'll show you the assessments we take our clients through, the corrective exercises based upon what we find during our assessments, and three-dimensional breathing and how we teach three-dimensional breathing. There's many ways to teach it. We like how we teach it. However, it's really about teaching the client to use their entire thoracolpelvic cylinder in the breathing process. And then the functional movement progressions using those ABCs. And we put together some really cool bonuses as part of this program because we wanted the individual to have a really complete look at how to use the system and plug this information right into the programs that you're already using with success. So I created 5 bonuses for this program. I created a quick start guide to really just give you an overview of the entire program. So I list why we go through the exercise we go through, why we go through the assessments, some of the common things you'll see with your female clients, and the approach that we use, the integrative movement system approach. That's a PDF that you can download that PDF. I also shot a video of the 5 key assessments that we use with our clients. It's not all the assessments we use with our clients, but it's the 5 key assessments that we use with the majority of our clients to help pick up those non-optimal and inefficient posture and movement habits that are leading to chronic tension, discomfort, and or inefficient posture and movement habits. I also go over the 7 key corrective exercises. So we show you how to teach alignment, how to teach breathing, and how to progress your client the most effective corrective exercises based upon the common findings of your assessments. And then the 7 exercises that you need to either avoid, take out of your clients' programs because they're just not good for the majority of our clients, and or how to modify some of the more common exercises like your clients like to do. Like some of our clients love doing those flutter kicks and those bicycle crunches, which are really terrible for a lot of our clients that have chronic low back issues that are related to disc issues, which a lot of our clients are dealing with. So they're not great exercises. So we give you modifications of those exercises so you still have things you can put into your program to help your clients so they feel their core working, because the clients love to feel their core working. There's nothing wrong with that. But again, much safer and more effective exercises for them to perform. And then also a program design guide, which is another PDF download. So that way you can see how we program these exercises into our programs and how you can use it with your own clients and plug it into the programs that you're already using with success. And I showed you the $197 price. However, on Wednesday, March 6th, in celebration of my 50th birthday, I'm giving 50% off all our products, our online products, the complete conditioning for the female core. We also have the complete conditioning for the shoulder, as well as complete conditioning for the knee, ankle, and foot. And we're also giving $50 off our 3-day live intensive. We have a couple different locations, Boston, Orange County, California, and Orlando, where we take you through the assessments and then how to develop your corrective exercise strategy based upon your assessments to pick up your clients' non-optimal and inefficient posture and movement habits, and to help them create those more optimal and efficient posture and movement habits, and how to progress them into the functional movement patterns. So squatting, lunging, bending, rotating, pushing, pulling, gait, balance, and carrying patterns that your clients need to do to be safe and effective in their exercise programs.
Awesome. I'm going to, that's kind of summarizes a big chunk of what we wanted to cover today. I'm just going to kind of kick you back. If you could go back a couple slides to that summary.
Yeah, for sure.
Because I just kind of want to talk to, since most people watching this are going to be familiar with me and some of the stuff that I've been doing, it's the exact same stuff. It's just
cool.
presented in a different manner.
That's
so
great.
If you like the stuff that I've been putting out, I know following you and the stuff we do just totally jives. And whenever I get to hear you say something, it's like, that's how I say something. So the stop gripping, like this brings me, like this slide right here brings me back to, I don't know, 2-3 years ago, I wrote an article on like the top 3 or 4 things that I wish I would have known earlier in my career. One of those is just like stop gripping. It's pretty much high threshold, low threshold.
Exactly.
So I talk about, it was an eye-opener to me. I was doing like a simple dead bug with somebody, but honestly, the amount of tension it took for them to just control their posture, it was like they were deadlifting.
Yeah, exactly.
So this is an exercise that your niece, little baby, is just super reflexive.
Yep.
She's able to maintain that with very little effort. So if you can get the exact same thing with no effort or very little effort,
yep,
you're going to be able to, goes back to all your get fit stuff. You're going to have the energy. You're not going to have the fatigue. You're going to be able to sustain much longer just because you have the right strategies in place.
Yep.
The ABCs, I think everybody's pretty familiar that I'm a big fan of breathing, but it's all about maintaining the posture alignment. And the progressions I don't know how much I use it with the Smart Group training crowd, but if you hear me in my gym, I'm a big fan. I'm always like, better is better, not harder is better. Because a lot of the times I'll kick people down into some regressions, and now they're just doing the exercise with so much better form and function at the right level of like high threshold, low threshold. Everything's just starting to mold. Their brain, their nervous system, their body can like adapt to it. So
Yep.
they're going to get a hell of a lot stronger. So as I follow the exact same stuff that you talk about, that's how I get a lot of my clients stronger. I don't necessarily have to. Most of them already have like the muscle strength they need. They're
Correct.
just in a bad position, bad posture, bad alignment. If
Exactly.
I can teach them how to do that reflexively at the subconscious level, I'm going to win.
Exactly. Every time.
So, yep, exactly. So it's just the more information you can get that kind of aligns and you hear from different people is definitely going to just help make you a stronger coach. So I'm going to fully back up everything that, one, happy birthday.
Thank you.
50,
Appreciate it.
50 is a big birthday number. So
It
if you
is.
want any information, if you like the stuff I put out there, Evan's stuff is only going to help deepen the knowledge of what I'm putting out there on a regular basis. So there's nothing contradictory. I've reviewed all the products myself, and it honestly gives me just more tools for my toolbox. So we have the exact same, our principles, our philosophies, they're all aligned. So
Awesome.
now I'm just adding different methods
Yep.
to get the job done.
Yep.
That way I have more tools for my toolbox, and some things work with some people, some things don't.
Exactly. Exactly.
So I think it's a fantastic opportunity for my readers, my audience, to take part of this and getting 50% off. Why not? It's best deal
Awesome.
you'll get. So
I'll send you you'll have all the links, so they'll be able to, on Wednesday
yep.
at 6 a.m. East Coast time. It'll be up and going through one day only, that Wednesday, March 6th through midnight. So look forward to it. And if anybody has any questions, you can always reach out, and I'm happy to answer questions and make sure that you get what you need from the products.
Awesome. I totally appreciate you taking the time to go through this, Evan. I'm just sitting here, if you're watching the video, just nodding along with a lot of this stuff.
It's awesome.
Because it totally jives with what I'm putting out there on a regular basis. So
awesome. Love it. It's so nice to see, because, in the industry, as you talked about, there's a lot of conflicting approaches and a lot of people saying a lot of different things. So people get confused. And so we have to be very strategic who we partner with. So and I reach out to you every once in a while when I read your newsletter. I'm like, man, I resonate with all your newsletters, but I don't reach out to you after every newsletter. But a lot of times I'm like, hey, Jared, straight on point. Really like how you said that. So it's great to find like-minded individuals who can share this mission, and just to up-level the industry, up-level skills, and get out there and transform a lot of people's lives.
rock on. Love it.